Time.
Yes, it is.
Yay.
I have packages all over my.
Having a baking going. She probably. Are the boys there? What's going on?
Oh, we're here.
Well, we can't see you. We can hear you.
Did you turn on?
I wonder if
Okay.
All I see is a screen that says health department when you talk.
He's coming down.
He's coming to help you.
The camera's off, I see up there. Our camera is showing off.
I don't know that this one. See, I don't have a camera, so mine shouldn't. I wonder if, you know what, it's because you have to display your camera over here, because mine, this one doesn't have video. Yeah, so if you want to display your video to the right-hand side of then we can see.
I apologize, we're having a little different technical problem than usual, so as long as you can hear us, that part's good, so. We're working on the cameras, so at the moment, and we got one of our superb technicians here, scratching his head.
There we go.
Whoa, okay.
All right, looks like we're set.
Okay, good. Well, welcome, everybody. It is Thursday, December 17th, 2020. This is the Washoe County District Board of Health meeting. It is being held as a video conference meeting, and notices have been sent out. First thing on the agenda, we will have a roll call and determination of quorum, please.
Chair Novak,
Here?
Vice Chair Brown,
Here.
Commissioner Burpegler,
Here,
Councilman Dare,
Here.
Dr. Danko,
Here.
Councilman Delgado,
Here.
Tom Young.
Here.
We have a quorum, Chair.
Good, thank you very much. Next thing is a pledge of allegiance. Mr. Health Officer, would you lead us today?
Yes, please join me. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much. I wish we could be yelling "play ball," but that doesn't work right now, so. The next item on the agenda is 3 is public comment. Do we have any public comment at this point? Good.
We do not have any registered.
Good. We have no registered public comments, so we'll move on to agenda item number 4, which is approval of the agenda. Do we have anything that needs to be changed or added to the agenda that we need? If not, I will go ahead and accept a motion to approve the agenda.
Motion to approve?
second,
Second, Danko.
Okay, thank you very much. All in favor?
Aye.
Opposed?
aye.
No opposed? Good. Thank you very much. That carries. Okay, Mr. Health Officer, we have recognitions for that, and I will take item number F.
All right. Thank you, Chair Novak. I'd like to begin with years of service, and today we're recognizing Jackie Lawson, who has 10 years of service with our epidemiology and public health preparedness program. So congratulations to Jackie. Thanks for her service. Sonia Smith, 5 years with CCHS. And so thank you to Ms. Smith. She's actually leading the medical group for the testing activities at the post. Julie Hunter, 15 years of service with the Air Quality Management Division. I'm seeing we actually have a typo on the agenda. So Julie's with the Air Quality Management Division. And a number of promotions. Want to congratulate Jeff Jepson. He's been promoted from Air Quality Specialist to Senior Air Quality Specialist. Kristen Palmer, who's been promoted from Grants Coordinator for the COVID response to Fiscal Compliance Officer. Nanette Kano, who is promoted from Account Clerk 2 at the Treasurer's Office to an Office Support Specialist. So Nanette was actually with Administrative Health Services previously, so she's continuing to be promoted, and we got her back.
Good.
So congratulations to all of them. And then we have a couple of new hires in environmental health. Renee Ballin and Chi Pham, who are both environmental health services trainees. And then we have a transfer. Nancy Kearns Cummins transferred out of the health district to administrative assistant 2 in animal services. She was our fiscal compliance officer, and Kristen is replacing her. And then I'd also like to take a moment to acknowledge Margaret Allen, who is the Director of the Washoe County School District Student Health Services, and she is retiring. So I want to recognize her for her commitment to the health of Washoe County children and for the leadership and spirit of collaboration that she's offered to the Washoe County Health District programs. By working closely together with the Health District Chronic Disease Prevention Program, Margaret Allen has helped provide supportive resources and education to students and their families to improve access to healthy foods, increase physical activity in healthy environments, and encourage social well-being and growth. Margaret Allen has been instrumental in working with our Communicable Diseases and Environmental Health Services program in efforts to prevent and curtail outbreaks in Washoe County schools. Her contributions, knowledge, and professionalism will be missed. The collaboration of Ms. Allen and Student Health Services with the Immunization Clinic helped to ensure that children received all recommended vaccines, including flu. Ms. Allen was responsive, hands-on, and worked tirelessly, ensuring access to vaccinations for the students of Washoe County School District. Everyone on the epidemiology team who has had the pleasure of working with Ms. Allen has been impressed with her ability to effectively collaborate and her desire to improve the health of children in our community. We wish her the best in her retirement and will miss working with her. I myself have also enjoyed the opportunity to work with Ms. Allen and have appreciated her commitment to the health of the students, staff, and families of the Washoe County School District. So Margaret, thank you for your willingness to combine efforts with the Washoe County Health District on behalf of the health of the children and families of our community. On behalf of the Board of Health, I want to recognize and commend Margaret Allen for building this partnership for health. I believe Margaret Allen is calling in today to be recognized. I know she is on and would like to make a comment.
Thank you, Kevin. It's an honor and a surprise to be mentioned by your team. I am retiring along with my husband, Russ, and we're really looking forward to it. With the vaccinations coming on, I hope to be a volunteer part of that. And again, I have truly enjoyed and appreciated our relationship with Kevin and the epidemiology team. It's been a fantastic experience. We've all learned a ton, and I wish you all the best. And Heather, I'll reach out to you when it comes time to help with vaccinations.
Excellent. Well, enjoy your retirement, and looking forward to working with you as a retiree volunteer.
Okay, thank you again.
Margaret, thank you for all your hard work. It's been quite a year, and from the whole board, we wish you a really good retirement. And thank you for volunteering, because we've now got your name and number. So thank you very much.
Right.
So
Thank you.
I'm going to take over the awards part on number F. And we have got several things that have happened in the last week or so. The Washoe County Health District was recognized by the Nevada Public Health Association, that's NPHA, this week for going above and beyond and having a positive impact on the public health of the whole state. And Kevin Dick, our health officer, has been named the Public Health Hero for his work on COVID-19 response, which is a special recognition to acknowledge the individuals who have made a significant impact on the public health of Nevadans during this COVID pandemic. And as just a personal note, Mr. Dick is hard to get a hold of sometimes because he's on so many state calls constantly, working for all of us on not only the local level, but also on the state level. And we have a very nice plaque with Mr. Dix on there. So we appreciate it. Thank you very much, Kevin, from all of us, and especially the state. One last thing as far as awards and recognition, the Health District Epidemiology Program was recognized under the category of public health programs, which constitutes a public health program, agency, or organization in Nevada that has made a significant contribution to improving public health in the state throughout the year. And Heather Kerwin is our program manager. She does, I believe, have a plaque and stuff recognizing this. And Heather has just been an amazing person through this whole thing, and probably spent a little bit more hours than she should have, but she's just a endless energy person for doing this. So Congratulations to all. Time to move on for number 6, which is a National Radon Action Month proclamation. Are you going to do it, or Andrew?
I'm going to do that.
Okay.
All right, thank you, Mr.
Yeah.
Chair Novak. Whereas many Washoe County residents don't know about radon, yet need to know for the safety and health of their families, as radon is a colorless, odorless, naturally occurring radioactive gas that is the primary cause of lung cancer among non-smokers and the second leading cause of lung cancer for smokers. And whereas the U.S. Environmental Protection Agency estimates 21,000 people in the U.S. die each year from lung cancer caused by indoor radon exposure, and lung and bronchus cancer kills more people in a year than any other cancer. And whereas radon kills more people than secondhand smoke, drunk driving, and home fires combined, and whereas any home in Washoe County may have elevated levels of radon, even if neighboring homes do not, and living in a home with an average radon level of 4 picocuries per liter of air poses a similar risk of developing cancer as smoking half a pack of cigarettes a day. And whereas testing is the only way to know if a home has an elevated radon level, and testing is easy and inexpensive, and when identified, homes can be fixed. And whereas University of Nevada, Reno's Nevada Radon Education Program, the Nevada Division of Public and Behavioral Health, and the EPA support efforts to encourage all Washoe County residents to test their homes for radon, mitigate elevated levels of radon, and have new homes built with radon-reducing materials and features. Now, therefore, the Washoe County Health District Board does hereby proclaim January 2021 as National Radon Action Month, adopted this 17th day of December 2020. Dr. John Novak, Chairman.
Thank you, sir. We'll take a motion to accept this as an action item. Do I have a motion?
I'll make a motion to accept the proclamation.
Thanks, Chief. Second?
Second, Christopher Dare.
Okay, thank you, Mr. Dare. Very much so. All in favor?
Aye.
Aye.
Opposed? Hearing none, thank you very much. We do go along with the National Radon Action Month. Okay, next item on the agenda is the consent agenda. Do we have anybody that wants to pull off anything specifically or talk about any specific item? Okay, I do have, Mr. Dick wants to make a comment on agenda item, let's see, that's 4, more just for information to explain a little bit more just what this item is.
Yeah, thank you, Chair Novak. I wanted to just spend a moment on this one because it's kind of a high dollar amount. This is for the interlocal agreement with University of Nevada, Reno, and it's for over $2.8 million over the next 6 months. And I wanted to explain that this is to continue for UNR to provide the staffing that we're utilizing for personnel in our call center, our disease investigation, and at the post operations. The state has been working with UNR and has been paying for the cost of that staffing through CARES money, and that's going to be ending on December 30th. So in order to be able to have the university be able to continue with these staff, we needed to establish this contract with them and sign it so that they didn't have to notice staff that they were going to be out of money under that contract with the state. And so that's why I went ahead and signed this, as did County Manager Brown, as an emergency action under the emergency declaration for the board to then be approving this retroactively. So I just wanted to provide that explanation.
Good, thank you.
Thanks.
Okay, I will accept a motion at this point to accept the whole consent agenda.
Move approval.
Okay, that's first, second?
Second,
Second, okay. Thank you, Councilman Delgado. Any discussion? Hearing none. All in favor?
Aye.
Aye.
Aye. Opposed? Hearing none, pass unanimously. Thank you very much, all. Moving right along. Okay. That's the end of the consent agenda. Item number 8 is a report from Regional Emergency Medical Services Authority and Mr. Dow. Dean, I know I saw you up there.
Sorry, forgot to hit unmute.
Okay.
Good afternoon, Mr. Chairman.
Still good to see you.
Thank you. Dean Dow, President and CEO of RIMSA, and Careflight for the record. You have all received a copy of our November compliance report for your review. Additionally, I'd like to add, Mr. Chairman, and to Mr. Kevin Dick, my organization's sincere appreciation in all the efforts of the health department, the health officer, all their personnel over this last year. Obviously been a very, very difficult year for this community, but also want to express our appreciation of all their efforts to distribute the vaccine as quickly as possible. And we know that the hospitals have already started vaccinating their personnel, and we're hopeful that we will start next Wednesday or Thursday. So with that, I'm available for any questions that you may have.
Any questions for Mr. Dow? With hearing none, I will take a motion to accept his report.
Move to approve the report.
Okay. Chris Dare.
Second, Rika Danko.
Okay, first and second. All in favor?
Aye.
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 Opposed? Hearing none, that is passed. Okay, do we have a public relations report today?
We do.
Oh, good. Hi there.
Hi. Good afternoon, Mr. Chairman, members of the board. Alexia Jobson, Public Affairs Manager for REMSA for the record. Of course, for your review, you have the public relations report for November. But recently, I have some updates. We made some enhancements to remsahealth.com in the news and updates section. There are related post recommendations, and it is now searchable based on category or date. These updates will make the page a bit stickier, so people spend more time reading additional posts. Also, last week, in preparation for the arrival of the vaccine, we held a series of employee forums during which we shared experiences from an employee that was seriously ill with COVID-19, a message from one of our medical directors, a presentation from a paramedic in Las Vegas who participated in the Pfizer clinical trial, and information about how the distribution will work in our organization. The sessions were very well attended. We opened them up to regional fire and law enforcement departments as well. And excuse me, and the sessions were covered on the news by Colo and KTVN. And I am available to answer any questions you may have about our public relations report.
Good. Any questions or comments from the board? Hearing none. Very good. Thank you very much. We are going to open a public hearing now for the review, discussion, and possible adoption of the proposed Washoe County District Board of Health regulations governing public accommodation facilities. And we have Mr. Rubio. Do you have any comments or explanations you need to move forward with?
Yes. Hello, Chair and members of the board. Good afternoon. For the record, my name is Wes Rubio, Environmental Health Specialist Supervisor for EHS. I'm here to present information to support the possible adoption of the Washoe County District Board of Health regulations governing public accommodation facilities. A staff report was included in your board packet, which includes additional information. All current public accommodation facilities were notified via email. Oh, sorry, screen freaked out. Were notified via email with information to access the proposed regulation and public workshops. During the public workshops, the proposed regulations were discussed in full and reviewed in full with all participants on the call and in Zoom. No public comment was received indicating any financial concern or potential impacts to existing facilities. There are no new fees proposed as part of these regulations. The proposed regulations are in line with other jurisdictions in the state and provide guidance and consistency within the state, aiding operations of many businesses that operate within Washoe County and Southern Nevada. Again, there will be no additional cost to implement these regulations as there is an existing inspection fee. The benefit will be an actual health permit to operate issued by the health district for all public accommodation facilities as established with the proposed regulations. These proposals were written and formatted to ensure minimal impacts to all existing facilities while establishing regulations for the Washoe County Health District, and again, ensuring consistency and guidance within the state. So with that, I'm available to answer any questions or comments that you may have.
Good. Are there any public comments or questions?
No public comment registered.
Okay, good. Well, I'm close the public hearing and we'll move on for. Oh, I'm sorry. Hi, Marcia. I'm sorry.
I'm curious, does this apply to vacation rentals or is this only for hotels, motels, that kind of thing?
This regulation only applies to existing public accommodation facilities, so hotels, motels, and those types of facilities that are outlined in the regulation.
All right, thank you.
You're welcome.
Good. Any other questions or comments? Okay, hearing none. Public comment, or the public hearing is now closed. I will take a motion to enact the regulations.
I'll make the motion to enact the regulations as presented.
Okay, that's first. Do you have a second? Everybody's muted. Oh, thank you, Dr. Danko. Hear you.
Mr. Chair,
Yes.
by way of just comment hearing, I mean, I'll support this, but I do want to go on record that it seems inappropriate to me that we are allowing people to come into our community, stay on vacation rentals, and we aren't requiring any assured cleaning and that kind of stuff, which worries me a great deal. But I mean, I think this is a start, but I think it should apply to all vacation rentals also. Thank you.
Okay, thank you. Any other questions or comments? Thank you, Commissioner. Okay, hearing none, I'll take a motion. We have a motion on the floor. It's been seconded by Dr. Danko. All in favor?
Aye.
Aye.
Opposed? Hearing none, this is passed, so we now have new regulations. And thank you for your comment, Commissioner. Okay, moving on to item 10. This is going to be the recommendation to change the employment agreement between the Washoe County District Board of Health and our health officer. Ms. Griffey?
Yes, this is Lori Griffey. Can you hear me?
Yes, ma'am.
Okay. This is Lori Griffey, the HR rep for the Health District. This item recommends that the board approve the request to amend Mr. Dick's, the district health officer's contract, to afford him the same benefit as other county employees, the ability to be paid for vacation time, which the employee was unable to use during the year. This is a benefit provided to the county employees under County Code 5, and we're just asking that Mr. Dick be treated the same as other employees.
Okay. Do we have a motion to accept this?
I move to accept this, Tom Young.
Okay, Tom, do we have a second?
This is Marcia, I'll second.
Okay, thank you very much. Do we have any discussion or comments?
I just have a discussion. I just want to make sure and clarify what exactly, I mean, when we go on this, we are looking at, in the sensification, I understand any of our, I appreciate being able to do that. What are the other main ramifications of the switch? How does this benefit or not benefit fully? I just want to make sure we understand that.
Lori, do you want to answer that?
Yes, what happens is it's an employee benefit that if they are unable to use their vacation, which this year has been very difficult for most of us, they are able to be paid out for the hours that are accumulated above the 240 limit. And that is, like I said, part of County Code 5 for all employees. And we're just asking that Mr. Dick get the same benefit.
Okay, thank you.
Okay. Any other questions or comments? Hearing none. All in favor?
Aye.
Aye.
Opposed? Hearing none. Very good. Congratulations, sir. You still don't have vacation, but you're now rich. So, okay, moving right along. Item number 11 is the calendar for the Health District for the following year, for the coming year, 2021. It says 20 here. Okay. if people have had a chance to look at the calendar that's included, I will take a motion to accept this. Okay, guys, not thought question.
I move that we accept the calendar. Tom Young.
Thank you, Tom.
And
Do
I'll
we have a-
second.
Second, Delgado.
Okay, good, very good. First and second. Any comments? Okay, hearing none. All in favor?
Aye.
Aye.
Aye. Aye. Opposed? Good, thank you very much. It is passed. Okay, we're down to staff reports. Mr. Vega, are you there?
Mr. Chair, this is Daniel Inoue, filling in for Mr. Vega.
Okay.
So Daniel Inoue with Air Quality Management. Thank you, Mr. Chair and members of the board. A quick staffing update. Earlier this year, we had several retirements that created vacancies. We are filling those vacancies. We are looking forward to having a new recent UNR grad to fill our inspector vacancy, and come beginning of January, we'll be back up to full staff. With that, available for any questions or comments.
Any questions or comments for Mr. Inouye? Hearing none, thank you very much, Daniel. Okay.
Thank you, sir.
Next person on here is Ms. Lockridge, who has been working unbelievably.
Oh, thank you. Good afternoon, Lisa Lottritz, Division Director for Community and Clinical Health Services. And I just wanted to provide a brief update on the COVID vaccination plan. We are getting ready to send out our invites for next week to the initial phases in Tier 1. And so we'll be opening the schedule up for that. And we have our vaccination schedule for next week starting on December 23rd. And today we will be out there supporting Renown in their first pod. So it's very exciting. That's all I have, but I'm happy to answer any questions about COVID vaccinations or anything in my report.
Do we have any questions for? Hearing none, thank you very much.
Well,
Keep
John,
up the good work. Yes, sir.
Okay. Well, we all have, I think, tons of questions regarding it. And I just, it's a lot is coming, a lot's going on. And obviously this is where, this is probably our biggest thing that we have to hope to move forward out of this. We'd probably, and I may have bring this in a board motion, just really helping everyone understand how this is fully going to lay out with vaccinations. And it's not something, I mean, I'm aware because I get to be in meetings, but even our public. So it'd be great to have some expounded knowledge that we could share with our public of what's happening here so they understand the steps that are being taken.
Sure. So tell me, I don't want to take too much of your time, but I'll start from the beginning. We will be receiving a allocation on a weekly basis from the state. And so for this week, it was Pfizer, and it was a 5-day allocation. And because hospitals are, acute hospitals are the first, they're Tier 1, priority 1, all of that vaccine went to them. So nothing was allocated for us to dispense. And then they asked for our second allocation, which starts on December 23rd. And we, from there, we finish what is in priority group 1, and we will move on through those priority groups. I don't know if any of you have seen those. That's very helpful. And I know we're trying to put together something that'll be more user-friendly for the public to understand, but it's Tier 1, Tier 2, Tier 3, and Tier 4. And then within that, there's priority groups. So the acute hospitals are number 1, and then it goes to long-term care facilities and psych and behavioral hospitals, and just on down the line in each tier. Oops, I think you're muted.
Sorry, yeah. It'd probably be a good thing, and maybe again, maybe you bring it up. I know it has to do with this, so I can talk about it now, but maybe a larger presentation because there's even a lot of questions of people. If they get a vaccine, do they still need to wear a mask? There's just all kinds of things that probably need to be answered about this. And I think that we are the first strain of information And so I appreciate it, and I think your report is good. So I don't really, like I said, so I want to be careful. I don't necessarily have questions just about that. I just want to try to make sure we open this up as big as possible. And so maybe I'll do that at the end of the meeting and make a request for a true presentation of it for public consumption so they can understand as much details as we know.
Of course.
Cool. Thank you.
Thank
Okay.
you.
Mr. Dick has a comment on this, please.
Yes, Councilman Dare, I just wanted to make everybody aware, we just have launched a new web page or a page on our website with vaccine information. So if you go to the Health District website and you click on the COVID-19 information, then on the page that takes you to one of the buttons on that page is vaccine. And so that'll take you to the page that actually provides the information on who is in each of those different tiers currently. And I say currently because those are established by the state and with CDC guidance. And so that may change as things develop, but that information is on the site. And there's also a number of FAQs that are there as well. So I would say that would be a good place to start to get up to speed. And that's available to share, of course, with our residents. And then we have just procured a URL. So we'll have a site set up just for the vaccine, similar to the Regional Information Center site for COVID-19 right now. So we'll be launching that as soon as we can get that live, and then we'll be also having that site as our Regional Information Center site for the vaccine.
Thank you. That's good. That's very good news to know.
Chris, this is something I think that you can run out through each of the cities' website, like Julie does all the time, to mention it, since it's just basically been put into action today.
I think it went up yesterday, and I sent it out to the city and county managers this morning so that they have that also.
And I just say this, and speaking to the choir, I know we all know this, but information education on this is going to be key for any application of what we're trying to do. And so the more people understand it and understand how we're taking steps, then I help everybody. So thank you. And we will definitely share that and use that. And I still will make a request at the end of the meeting for a future agenda item, but that's fantastic. Thank you.
Good. Thank you. Next on the agenda is Amber English, Environmental Health Services.
We didn't vote on that, John. I interrupted your vote.
No, we don't need to vote on that.
Okay.
This is staff reports.
All right, good afternoon, Mr. Chair, members of the board. Amber English, Acting Environmental Health Services Division Director for the record. I just want to highlight.
Oh, thank you.
Sorry, can you hear me?
Yeah, now we can. Good.
Okay,
Thank you.
okay. I just want to highlight one thing out of our report, and that is a project that our food safety team worked on. It's the Excellence in Food Safety Award. We are accepting applications on our website. Any food establishment that wants to apply, that's open to every Washoe County food establishment. But it's just a way to recognize those restaurants. Basically, it could be a mobile truck, it could be any food establishment that's going above and beyond in their long-term commitment to food safety. And it's a project that our group worked on despite COVID and everything else over the last few months. So it's something really positive that I just wanted to highlight. The winners of that award will be announced in January. They'll be recognized at the Board of Health. They'll also receive a certificate that they can put in their window of their establishment. They'll get a digital logo they can put on their website. And they will also, we're working with our app designer so that it'll also be recognized on our Washoe County Washoe Eats mobile app as well. So just wanted to mention that. Otherwise, you have the report in front of you and I'll answer any questions.
Okay. Any questions for Ms. English? Comments? Good.
I just have a comment, Tom Young here too. And this, I think the staff has gone well above their call of duty here by working on this particular project at this time too, because it's so easy to throw down the hammer and things and talk about, issues that struggling businesses are actually trying to comply with right now too. But it's an awesome thing. I hope we can continue to give awards like this and really recognize people and help those who really, give them a shot in the arm and say, hey, you're going beyond the call of duty. And I'm hoping this continues and improves as we move forward in the next years.
Thank you.
Okay, very good. Any other questions? Hearing none, move right along. So, Ms. Epps, are you there?
I am here. Chair and members of the board, Andrea S. For the record, you have my report in front of you. I have nothing to add to it, but I'm available to answer any questions that you may have.
Good. Any questions, comments? Hearing none, thank you very much. Hope all is well with your house full now.
Thank you.
Okay, down to the District Health Officer, Mr. Dick.
Yes, thank you, Chair Novak. Hopefully, as far as my COVID update goes, I hope everybody had the opportunity to see the simulcast that was aired last night, Fighting COVID Together, that ran on a number of our TV stations. So I'm very appreciative of the broadcasters working together to put together that great content for us to better understand some of the impacts that are occurring in the hospitals and in businesses with COVID-19 and how together we can work to move forward and to prevail with the vaccine that's coming. So it was just I think a historic effort. So it was great to see them supporting our community like that. As far as the vaccines go, Lisa gave us an update. And this afternoon at 3 o'clock, there is going to be a media event with Renown and their use of the pod infrastructure that we have at the Reno Livestock Event Center. So they'll be vaccinating their first frontline healthcare workers there, and then they'll be continuing to operate through the pod over the next 5 days to get through their first allotment on the vaccine. We are continuing to work on our vaccine plans. It's obviously going to be a very, very challenging effort to get this rolled out throughout our community, not just getting shots in arms, but also getting all of the data entered, tracking all of the vaccine usage and getting all the data entered for each individual that's vaccinated in the WebIZ system, and then also being able to work with those people to get them back on time for their second scheduled dose of the vaccine. The Congress is in discussions on stimulus funding with support for the vaccine being part of what's being discussed, as well as support for continued testing and contact tracing. So we're in a position where we are running out of CARES funding at December 30th. It no longer is available for us. And so I identified some of our upcoming costs to be able to continue with Charles River Labs and to also be able to bring on the staffing that we need to be successful with the vaccine operations. And I've had discussions with the city and county managers, and they are willing to work regionally to provide support for the funding that we need. And so we're working with them on getting some agreement on that level of funding. And that would be for FEMA reimbursement if there is no congressional funding that comes forward, FEMA reimbursement under the emergency declaration. But we anticipate that we will have federal dollars so that we would have grant funding to use for these costs moving forward. And also on the consent item earlier today, I meant to mention that $2.8 million is covered by the ELC, the Epidemiology and Lab Capacity Grant that we have through a federal grant passed through from the state. So we do have grant funding for that, but it's not going to cover all of these costs. So it's important that we receive that federal stimulus funding soon, and I know our delegation is all engaged in supporting that funding for public health. And Aaron Keniston is going to be stepping down as the incident commander. He's retiring effective January 3rd or 4th. And so he has got some vacation time he's going to use before then. Dave Solaro, the assistant county manager, has agreed to step forward to serve as the incident commander for this moving forward. So I wanted everybody to know about that as well. I did also provide some information on the health district's appeal process. Councilman Delgado had requested some information on this. I believe it was Councilman Delgado, and so I included that in my report. But I think the bottom line is for our regulatory programs in environmental health and in air quality, there is an appeals process, and we have boards established that the District Board of Health appoints the members to which appeals can be made, with a couple of exceptions, and that is on the NAC 445A, which is construction of water systems. That does not go through our appeals process, but there is under the NAC an appeals process that goes back through NDEP, the Nevada Division of Environmental Protection. And then under SB4, we don't have an appointed board to be an appeals board for SB4 if there are disagreements on enforcement action taken with that. We do have an appeals process where if there's a disagreement, the property can come and meet with EHS and further discuss the citation and see if there's an agreement on changing that enforcement action. And then without that appeals board, there is then the appeals process that properties could appeal directly to the District Board of Health. And so that was established that way because of the way the state regulations were adopted and the requirement that we have our regulations try to be as close in conformance to the state regulations as possible. So, so that's my summary. I'd be happy to answer any questions here or follow up offline if people want to do that.
Good. Any other questions or comments? Oh, you guys more?
I do have one other thing, though, I do want to mention is I had as an item here that I was working on the recruitment of a division director for epidemiology and public health preparedness. And I'm happy to inform the board that Dr. Nancy Doe has accepted that position. She has a PhD in epidemiology from Harvard University. She has experience working as a researcher with the Harvard Global Health Institute, and most recently she's coming to us from the Rhode Island State Department of Health. And so she's scheduled to start with us on February 1st, so I'll be able to introduce her to the board during the February meeting.
Good.
Thanks.
Thank you. Any other questions for Mr. Dick or comments? Thank you for explaining the appeals. I knew we had a bunch, but it's good to know how it is and kind of refresh everybody's memory that can be passed on that one too. So next item on the agenda is board comments. Do we have anything that's a request for future items, reports, addendas, updates, anything like that? Yes, sir.
I got a comment I want to say. I first want to just say something at large, and just as one of the things I think that we get to walk in a room and we get to be the experts in the room on all this health stuff, which I don't question that. Matter of fact, I brag about our health department and the expertise that they bring to the table. And when someone's an expert, someone you can use that to help educate people, or we can go in and mandate things. And I want to just continue to challenge us in this time for everybody. And I hope this is said clearly, and I can't speak for the rest of the board, but I think I know them, and I think the heart of what we're trying to do with everything is to help lead our community through a very, very difficult time. And with that very, very difficult time requires a lot of education, a lot of walking with people. And I just hope that that is the tone that is used in every form of mandate. I know we even have some new regulations, and that right now terminology regulations, if done wrong, worry me, because we have people who are struggling. Their businesses are getting shut down. They don't know what tomorrow holds. And I just want to say at large, please help make sure that as we walk forward, that we are the professionals in the room. Our health department, you guys are the professionals when it comes to this. And you get to be on the front lines representing us. So please make sure that that is how I would like to see us laid out anytime we're walking forward. And it doesn't mean we don't have enforcement. I'm not saying that. There are times that that's the only way we can really help somebody is by making sure they do what needs to be done. But that should not be first resort, but last. And with that said, I do ask that we would have a report on vaccines come back. And I know people can go to the website, but some people won't have access to that or won't do that, or I don't know. You just know people every step they take. I really believe we need to over-communicate just how these are getting laid out, what we're doing, and give as much information on all of it as we can. So I would appreciate that as a well-done report that can really go out. Thank you.
Okay. Thank you, sir. Any other comments or questions? Agenda items from the future? Okay.
Oh, Marcia's got something.
Yes, Marcia.
I just wanted to say this is my last meeting. It has been a great pleasure serving with all of you on the health board, and I have enjoyed it very, very, very much. And I am going to miss you. You are. There aren't many boards that I can say this about. You are one of the boards that I have enjoyed immensely serving on. So I don't know who the replacement for me on the county will be. That decision will be made by the commission once it's seated in January. And I wish you all luck. I know you're going to continue to work hard. Kevin, congratulations on your award. It's well deserved. You've done yeoman's work on this pandemic, and I appreciate all the work and time and effort you and this county manager and the city managers have put into all of this. It's a tough time, and I know that you guys are going to continue to do great stuff. So thank you very much, and bye. I'm not going away, but I'll say bye anyway.
Okay. Thank you, Marcia. That just kind of stole some of my comments right off the bat. I want to thank you, Marcia, for being there when we needed. Thank you for answering my phone calls sometimes and kind of giving me some guidance on what to do and what not to do. And I appreciate your years of experience. And I want to go along and congratulate you for years and years of good experience and advice and leadership for the whole county. So we will miss you, Marcia. Don't be a stranger. You know where our phone numbers are. So thank you very much.
Thank you.
I want to thank all of the people in the health department very sincerely from all the board members. This has been an incredible year. There's lots of things that you can say it's unprecedented and everything else. To us, it's just been a massive amount of hard work. At times we have had to kind of invent where we're going. There's no instructions, there's no guidance that's come down ahead of time. And the imagination and hard work that everybody's put in on this has just been incredible. Now we're in where we might be able to see a little light at the end of the tunnel. The vaccination group that's been working it's just changes hour by hour. I got a couple changes that I heard walking down here today. So hang in there, guys. We're seeing a little light and stuff. I do want to thank our PIOs and our communications group from the cities, the county, and everything else for a really good presentation last night. It was one of those presentations that was unprecedented, that all the communication people and everybody in this town got together at 6 o'clock last night. It was hard to miss what was being said, and there's a lot of hard work went through it. And this is kind of an end or just a very good finishing up on the mask on, move on things that comes here that was initiated by our health department too to get people going. It just turned out the massive part of the end of the effort just came in at a perfect time. So we hate to see us growing in a surge, but our end of that campaign, or the main part of the campaign, not the end of it, hit at a very good time. So I want to mention that. I want to thank all our board members for a very interesting year, for a lot of hard work, a lot of comments that's come back and forth. We're really trying hard to make it good for everybody, keep everybody alive and well. And I want to wish you all a very happy holiday season, and we'll all see each other back in January for a really good year. So I will take a motion to adjourn.
So moved.
So moved. Second?
Second.
Good. Thank you, Marcia. All in
Bye,
favor?
guys.
Yes, ma'am.
You need to open it up to public comment.
Oh, I'm sorry. I'm sorry. Yep. Let's do public comments. That's number 14, the last item on the agenda. Any public comments?
We have it on register.
Hearing none. Thank you both. Hearing none. We'll stand adjourned. Thank you very much.
Bye, everybody. Be safe.
Thanks.